about what types of capabilities we can represent through a connectathon type approach, but also taking a hackathon approach to seeing how far we could stretch that out. So as we start to talk about these in more detail and we start to use, both Alex and Yuri's stories as a backdrop for our conversation, we can also start to be thinking about, in each of those clinical settings, what are the types of capabilities we want to represent and how could we take that further, noting that, there's consumer aspects and others that we can take into consideration. So I think we'll go into a bit more detail through this call around the key components of these stories, but in terms of intentions, there is going to be further work done through the policy demonstrator space, but I think we have a great opportunity to test this model in the next Connectathon as perhaps something that could be a standing item or a regular item at future Connectathons, where we start to look at a connected flow of system connections as opposed to the standard testing functions. I might flag if there's any priority questions, otherwise we'll start to go into what the purpose of the track is and some of the goals that we're setting out to achieve initially. All good.
Okay, so I might jump in here. And so pretty much as Jai mentioned, what we're looking to do as part of this track is to bring to life the demonstrator that was presented in 2025, turn it from that vendor agnostic mock-up of what is possible into something that is very much possible now. And it is only 6 months down the track, but we've got a lot of those key components or themes have progressed in that 6 months. So we've now got provider directory well advanced. That'll be coming on board very soon. We've got things, a patient summary implementation guide that's now released as of just this month. We've now got a project that's being stood up around encounter records. We've got demonstrators around care plans. So we've progressed a lot in the last 6 months. And so implementers are actually starting to do this stuff. And we want to actually show that it's not just a mock-up. It's not just smoke and mirrors. It is actually real. And will become more real in the very, very near future. So again, it's to demonstrate those HL7 VIA and Spark implementation guides that can truly deliver that integrated end-to-end experience across a consumer journey. And I've mentioned some of those areas, some of the other specifications that we're working on, like the structured document health checks, using some of the core FHIR implementation guides, Smart App Launch, etc., and really take this hackathon approach and see how that works, rather than something that is what we've been calling connectathons, which is taking our existing implementations and making them work together, actually develop something a little bit new and innovative, and really build on and extend our thinking. So again, the opportunity for vendors to demonstrate their abilities, demonstrate the standards that we've been working on, demonstrate innovations that you're working on. AI, as an example, has really taken off over the last few months or perhaps a year, but there are real products out there that are offering these capabilities. So where does AI fit into the interoperability space? And in the end, it's that shared experience of those that haven't come to a Connectathon before. These are really, we leave our competition at the door and we move into that collaboration. And so we're sharing our experiences and just lowering our barriers. But we're, speaking to Jai, he's really keen to find what are the gaps? What are the gaps in policy? What are the gaps in the standards area and the like?
So I think it's touching on that, Heath. I think it's a great opportunity for you as part of the community as we're doing these connections and we're starting to push the boundaries of what can be done now versus what can be done in the future. It would be great to understand where there are some clear constraints or barriers, particularly in policy and legislation, as well as infrastructure and those components. And I think that would be great takeaways from this community approach to inform government and others.
Okay, so just if we can jump back to the Minty again, and we've got a couple of extra topics that we would like to run through. Just to gather some information from you, who's here on the call, what systems and things that you're looking to do. So this one is just, what kind of system your organization is actually going to bring. This is only a single choice, and we want to do some analysis after this from these feedbacks. So to be able to do that, I have to make it a singular. So if you've got a couple of different systems, then perhaps just choose your primary one. And again, it's practice management's pretty broad, but that does include things like specialist practice management systems, allied health, as well as primary care systems. Anything that's sort of middleware might fit in that health information exchange position. So, and I see that there's quite a number of other in there as well. So, I'd actually be really interested at this point, maybe perhaps just in the chat, if you could indicate what you consider other, rather than just asking you in person to do it, if you wouldn't mind just putting your other kind of system in the chat there as well, and we can take that offline. So we've got a pretty good 17 of 19 on that one, so we'll move to the next one. Now we're looking at which standards or specifications you're working to, in particular FHIR ones, whether they're via core or some of their implementation guides like Smart App Launch, etc. And also our localized Spark implementation guides that we've been working on, AU Core, AU Requesting Patient Summary. We've also got the International Patient Summary there, which is a FHIR defined one. And if we've got any others out there, and again, if you've selected other, if you can include what that other is in the chat. Really good to see lots of implementations of core, and I'm actually really impressed about the e-requesting side of things, and patient summaries up there as well, which is great. Okay, so we've got 16 of 19. I'll just give you a couple more seconds if you're just lagging. I did get one extra response last time. All right, I'll move forward. Okay, so back to the slides again. Did you want to run through this one, Jai, or you want me to skim through it?
Yeah, just skim through it and then we can get to the detail.
All right, so as we introduced, we've got two stories, and we won't go into detail here, but there's a lot of detail on the screen, and this is more for reference for you to look offline. So these slides will be available offline. You can have a look through them, but I've also done a couple of wiki pages where these slides, and hopefully that's okay, Jai, to put them out there public. Obviously, the slides are going to be public anyway, but so I didn't think that was going to be a problem. So this is Alex. As Jai mentioned, she's a young mother who's a very busy businesswoman as well, but she's actually had a cervical screening and that's coming back at normal. So now we were going to follow her journey through that healthcare for that particular incident. And we've got a number of scenarios that we took her through within the demonstrator. And this was literally a set of booths that we had people telling the story of Jai, where clinicians that were actually providing their perspective of if Alex came to her, what could that journey look like in the future with a more of a digital health perspective of things. So we started out with a pathology collection centre, we moved on to a general practice, and then the specialty consultation, etc. But as the story was quite deep, and I'm not going into the full detail around this because I don't want to put too much restriction on this. But basically, in summary, there was this cancer registry scenario. We had a consumer app that was actually sending notifications back to Alex about the fact that she's had some high risk markers. There was some e-requesting aspects of that. And then over in the general practice, we had some lab reports coming back. We had a patient summary, there was a care plan, and some further e-referrals out to specialists and making some digital appointments. Then at the specialist, we had their notes coming back into the care plan, so it was available to the rest of the care team. Further diagnostic reports and then e-prescribing, theatre bookings. And again, Alex is always being kept up to date with what's going on within her healthcare through her consumer app. Through to day surgery, where we've got pre-admission forms. So we're using some of those structured data capture specifications that may be able to do those sorts of forms. We've got some theatre consent that needs to be exchanged with the hospital, some procedure notes that come out of that procedure, discharge summaries, and further appointments for follow-up. And then we're moving into the pharmacy, and we've got those e-prescribing coming through. But as part of the pharmacy, we want to actually look at what other dispensing history there might be for Alex, and then getting some CDS around the medicines that is more national based rather than localized. And as part of we might be moving into the new modes of health services where the pharmacist is actually able to do a consultation with Alex. And we've got the consumer app providing some reminders about taking her medications through to Allied Health. Scenarios on the right, again, there's provider directory capabilities to find a particular allied health service or a physiotherapist in this case. And again, the care plan is there being the main point of entry for the care team and Alex herself. And of course, we've got things like remote monitoring that can actually start to become part of our electronic health record that's maintained and from our own devices.
I think you can see. Sorry, I think you can see from a lot of those components, there's a mixture of current and future states, and certainly the shared care plan or perhaps a shared care view was one of those where sort of a future consideration of what could be possible. And I know there's some emerging work through different channels, and I'd be interested to see how that could be represented through this track at the event.
Yeah, that's right. And so then we've got Yuri's story now. He is a slightly different scenario where he is older, but in this particular case, he's actually visited family in the ACT, but he normally has his healthcare in a regional area in Western Australia. And he's actually a resident of an aged care home. So there's a lot more scenarios going on here. We've got some virtual triage that's going on with Health Direct. So again, some of these new modes of providing healthcare that we're starting to bring in. We've got some ambulance and emergency department details. We've got hospital and discharge again, local health services being used there, and specialists, and then aged care coordination again. So there's quite a few different areas there, but basically what we're getting to a point is some very common themes here. We've got patient summaries, we've got encounter records, discharge summaries, we've got diagnostic reports, e-prescribing and dispensing histories. provider directory is going to become very important to many of these scenarios as well, and in particular around requesting referrals, bookings, and appointments. And then we've got structured forms that are starting to look at how we can actually make these national forms or state-based forms, but also making them available through consumer apps rather than through paper. Care plans, as we were mentioning, the whole continuity of care, remote monitoring, etc. And then there's some, I guess, orthogonal themes here as well. Population health, from all of those domains, all of those information sources, getting notifications moving around the system, whether that's not just to the consumer themselves, but potentially back to the clinicians. And as I mentioned before, sort of national clinical decision support services and AI assistants that are becoming very prominent. So I guess those stories were really just to provide some guidance, and we've actually done a lot of work around getting some test data, etc., that was actually used by the vendors, even though they were mocked up. That was just getting that continuity of the story moving through, so we could potentially leverage some of that test data. So, but we're not tied just to the story. But I think we can actually sort of see these at a more abstract theme level to see these are the sorts of things that we can pick from and see where that might fit into some of these stories and those particular stations. Is there any questions at this point? Ilya.
Yeah, so I think that population health insight maybe one of the most important parts, because like in the end of the day, like population health and reporting is something that stakeholders from government and so on, that's something that they want. So we don't just need to demonstrate how the data flow, but how changing from unstructured and fragmented format to a structured FHIR-driven ecosystem allow us to improve reporting and provide some metrics to show the whole insights on the population level. I think it should be a very important part of the demonstration.
Yeah, exactly. And those last three, as I said, I kind of see them as orthogonal to the others. The others are very vertical or whatever, but these last three, they're very much horizontals, or you can flip that around 90 degrees, whichever you want to do with vertical and horizontals, but they are orthogonal to them. They're across the whole of healthcare. We want notifications across all of the healthcare, AI, etc. So yeah, anything that we can think of in any of those spaces, and completely agree, Ilya, that population health, and Jai, you probably want to comment on that as well.
Yeah, I think very keen to see how we can sprinkle that through both journeys along the way. From a presentation perspective at the demonstrator in November, we certainly had the population health and we had a learning health system concept at the end. But I think in terms of representing the flows, it'd be great to show that emerging connection as the stories play out in a more mock live environment. Phil.
Yeah, one question that I had on this was it wasn't so much on the last few slides at the high level, but at the deeper level, there was a lot of futures thought that did not exist yet, right? As far as patients being able to self-select a whole bunch of things and self-refer through various portals and all that kind of stuff. So I guess it doesn't represent the workflow that clinicians understand today, or that systems are set up to do today, right? So are we trying to, is our goal to keep that future vision and say this is how it might work, knowing that systems are not doing that right now? Or are we trying to, bring this more into what might be the next step or two beyond what we do today? I get that that's kind of out there, but as we're thinking about these scripts, are we trying to bring them back closer to reality, maybe with a step or two of FHIR sprinkling around it? Or are we really trying to stay in that futures view, which means less practical implementation or integration.
So I think we clearly want to show that the practical implementations, and I think that's where the cleaner flow will come from. I think some of those future aspects, that's really the testing point for the hack aspect of this this track. So I think I know where you're going, Phil, and we certainly want to represent how the standards are being adopted now and how that's emerging through current systems, whether that's in production or potentially in a development environment. But I think the hack aspect is certainly intended to take that beyond in where it makes sense and where it's possible. I think we know there's certainly some reference implementations and other components that are emerging through different groups that might play a part in taking on some of that load. But certainly as we start to go through these workflows in more detail, I think it'd be good to identify through the participants what is possible, what's emerging, and what is that, I guess, that spin into a hack versus actual capabilities today.
Yeah, and I think it's a really good question, Phil, and I think it's a question back to everyone else on the call. You know, what do you guys want to get out of it? We wanted to, you know, there's various people, I guess, different organizations will maybe be more agile than others. There's certainly people that we've included that are perhaps more on that research side of things, R&D side of things, and then there's others that are a little bit more restricted, and because you've actually got legacy/production systems out there that are a little bit more challenging to change on the fly. So yeah, it really comes back to you guys, what you want to be able to achieve. Things like provider directory services are not yet production, but they're able to be tested. So there's an opportunity for those that want to connect to provider directory in the near future to have a crack at that as part of this hackathon. And that might be something that may not get put into production for another 12 months, but at least here's an attempt to get some early learnings around that.
I think a point of clarification too in the way that this event is intended to play out is we want it to be something that is promoted, and we want to have some clear callbacks coming out of the event. And I guess the point of difference to what we did through the policy demonstrator to what we are hoping and planning to do with this Connectathon is that the vendors, the participants can be called out in their own right. And I think where those concerns may fit, maybe in your space, Phil, and others around what is current and achievable versus what is a future state, we can also use that narrative and that language in how we describe things to make it clear as to what we've represented, how it's been represented, and where there are those limitations or constraints within a future state that doesn't exist now versus the emerging capabilities. I think Andrew was next.
Oh, Joe, I just wanted to follow up on what Heath was saying. So Heath, would the provider directory APIs be available even for this event? Is that what we're saying? Have you got a timeline on that?
Do we have a Uday, are you able to comment on that?
Yeah, so my understanding talking to Nicole was that they will be looking to have a provider directory. We will also have potentially our own connection as well. So there'll be something there for the provider directory. Additionally, Nicole had indicated looking at trying to have a rudimentary record locator. So there'll definitely be functions that we can leverage on the day.
Yeah.
But she's in New Zealand, so I couldn't confirm.
Yeah. I suppose the point, Heath, is we at Fred IT are keen to demonstrate, as you know, some connectivity to the patient medicines history, but we'd also like to be able to make sure that our other systems could connect to what other people are offering. So we're keen to hear what other people are potentially taking to the Connected Care event, the Connectathon, so that we can sort of broadly scope other applications that we can get out of it too.
We are, definitely looking at publishing the latest FireRG with AFCP logo on it. We're just finalizing a few niggly bits which are left around with HCPD, and probably this or next month we will publish the finalized IG for HCPD. provide directory.
Andy.
One of our challenges at the demonstrator is I think many vendors have lots of interesting ideas. The challenge was when it comes to a connectathon and connecting technically is actually having the same specification and the same foundation. And a lot of our standards we've worked upon, AU Core, AU Base, Patient Summary, most of those are context neutral. So they're building blocks for something. And the agreement on the workflow and the kind of specification of use for a particular use case makes it then interoperable and kind of end-to-end capable. And I think that's the biggest challenge for many of us is moving to that consistent interpretation, because the interpretation of the base standards are fine for a particular resource in isolation, but how they work together in a particular context of use is quite varied in the overlay we put on that. So, and just my experience is connectathons aren't very long. In fact, the time gets shorter and shorter every hour that you're there, and it's quite hard to arrive with a blank sheet of paper and build from that point connections unless you have those very concrete kind of specifications before you get there to have set yourself up for success in some of that. So, for instance, like referrals, we've got general ideas around how requesting patterns could be used for referral, but there's an enormous number of questions about the workflow of a referral versus a standard diagnostic request, for instance, and these kind of things. So I think we've just got to be quite careful about how we are expecting to create these shared outcomes. I do find that a challenge.
Yeah, I think it's thank you for raising that, because it is exactly why are we starting today is probably we didn't really go there, and it's to some extent exactly why we're starting today is what you've just stated, Andy. And I'm not I think that if I'm understanding you correctly, you're probably raising some concerns, and I'm not downgrading those concerns. They're absolutely my concerns too, and why I've kind of really keen to get this weekly get together starting 6 or 7 weeks out from the actual event. Because certainly from the experience I've had when I went to Rotterdam recently, when we were testing some patient summary, that we had a group of Australian vendors that I was able to help represent at that Rotterdam. We worked for about 3 or 4 weeks together to basically, although we're all implementing patient summary, we had a good generic spec, as you say. We had little variances in the way that we did authorization, the way that we launched it out from one system to another. So this is exactly why we're starting today. One, to get the introduction, but then to start to work out, okay, we don't expect to do both stories or whole of both stories, maybe a few parts of one story or the other, based on your interest. And the next set of mentees is actually going to start to get a very high level understanding of what you are actually interested in, and where that might fit, to see where the clustering of people are, so that we can start to bring you guys together and you can actually start to work out some of those things, whether we end up with a spec out of it or whether it's just a working demonstration of that, which might then lead into a spec. And I think your point around e-referral was a really good example of that, Andy. So that's exactly why we're meeting 6 weeks out, and intending to do this on a weekly basis. And again, we've obviously brought the leaders of the organizations here today, but there might be a progression of other people coming into the group, perhaps more of your architects and devs that start to actually, as we drill into the detail, start to bring some of these other people that need to be there on the day as well. Again, the intent is that this is a hack. So we're going to be doing development on the day. How does that work? Don't know. Haven't done this before. So we're interested in your feedback, learnings. It might be a complete mess, but we will certainly learn something from this so that we can hopefully do it better next time. So yeah, Andy, I'm really hope that you can put your thoughts in, along this lines with us as well. Mike.
You may have answered my question, Heath. In all, I'm sort of building on what Phil said originally. If the goal is to sort of either do art of the possible or what's out there now or what's practically possible within the existing standards, and apply it to what components of the actual stories, or say, hey, there's this component of the story not end to end, or try and coordinate, because there was at the connected care there was quite a strong focus on coordinating between vendors. Is the goal here to sort of do something similar again, so that not everyone goes and does story page, story, the first 3 parts of a story because it's very easy or whatever? Are you trying to see a little bit of coverage across the story, or have it malleable that it could change or add to, or hope that made sense. I'm trying to get a little bit of clarity.
It's a good question. And I think we probably throw it back at you guys. What do you guys want to do? I mean, ideally, from my perspective, if we can get a bit more coverage and not just do one station. That's what we do at Connectathons now. So the whole point of this is trying to actually take on a journey. So whether it's that end-to-end, as we sort of said in the introduction, that's what we're trying to achieve. So yeah, we're trying to allocate perhaps some of those that are more agile to perhaps focus on something that they don't have out of the box, whereas some of those that may be less agile, perhaps they're the ones that can focus on just providing the part of the story that they can support out of the box. And again, when it gets to things that like population health and AI, those that want to be innovative in that sort of space, they can come and add a little bit of cream on top.
That makes sense. Thanks.
And I think, you call out Mike as a good one. I think what worked well with the demonstrator was those little groups that formed in certain stations or connecting stations, because it made a lot of sense to see how the natural connection points and flows were. So I suspect that's where we'll land with this conversation. But like Heath said, we're also wanting it to be a group decision around how we approach that and what makes sense. Andrew.
Joy, I thought your initial presentation was very clear. Obviously there's going to be some variations to it, but I understood it to be, let's build on what we demonstrated as concepts at the November event and demonstrate that we've actually got somewhere into reality. And that's what we're proposing. I suppose what I'm keen to hear from others is, what opportunities, functionalities they're bringing, because as much as we want to demonstrate a connection to a patient medicine's history that draws from the National Prescription Data Service, delivery service, what we'd also want to know to decide who we're going to bring along is what others are potentially offering that we could connect to, say, with our dispense system, for example. So I just wanted to put it out there that what Fred IT is hoping will be bringing to this Connectathon is that at the November event, we demonstrated a concept that was really saying, look, in our dispense system and in our prescribed systems, all we see is the patient history of what's been dispensed or prescribed in my own practice. But gee, wouldn't it be good if I could demonstrate a complete medicine's history from all prescribers and all dispensers? And that's what we're hoping to demonstrate at this event and have an offer and APIs that will allow systems like Medical Director and Best Practice and Oracle to connect to that and display that complete medicines history. So as much as we'd like to put that out there as what we'd be bringing to the table as an extension from what happened in November, i.e. concept to reality, what we're also keen to hear about is what others are doing so that, we can suggest how we might involve our dispense system software to that new functionality through FHIR. So is that an appropriate sort of? I just really wanted to put that out there because I'm really keen to hear not only us putting something out there, but what else can we utilize to work with others.
Exactly right, and I think that's the initial part of the data collection that we want to have here, and then we need to have some discussions around how does that start to fit into capabilities that either exist in the current story or perhaps there might be other capabilities that can surface as well. And then we can see where it makes sense for groups to connect together.
So I think there's a bit of a mix of people that were involved, Andrew, and those that aren't. So we're still today kind of in this mix between trying to, at a higher level, present what the stories are. So I think we need to give some time to some of those people that aren't familiar, some time to digest the material offline. And then I think we'll have that probably two-way conversation a bit more next week. But what I'd like to do is just as Jai, capture a little bit of information. Again, this is going to be a bit more challenging for those that are new to this concept and new to the demonstrator and the stories. But we will want to, but just, again, I don't know how this is going to work, but we've got a couple of mentees that will try and put it in the context of Alex's story for starters. And if you're kind of getting a bit of a feel for what might be something of interest to you. So if you are familiar with it, you probably know where you played in the past or where you could have played in the demonstrator. But those that are new to this, if you are in that general practice environment or in the pathology space or in the specialty space, you could probably put your tick against one of these particular stories. And I'll have a similar one for Yuri. And again, this is very high level. I know you haven't had a chance to go into the story yet. So that's what we're really just looking at, that very high level thing, keeping in mind the themes that, again, I probably should have had the themes overlaid on this diagram a little bit there. But if you just think about even those themes and where they might fit into these stations, and you'll also, in a moment, I've got another one which will actually get your feedback more from a theme perspective, which, so across these stories, more of a theme level. Is there any questions on what I'm asking you to do here at the moment? No. So Alex's story got pathology, or there's some doing some requests, there's some notifications in there. There's some consumer app aspects. GPs, there's some e-referrals in there, some diagnostic reports, specialists. There's some appointment bookings after hospital. We've got some discharge summaries, got some discharge prescriptions coming out of that, and then the actual pharmacy side of things around the e-prescribing aspects, the actual dispense history side of things that Andrew was talking about, and then, of course, off to some allied health space as well. I'll just give it another 30 seconds before we move on. We've got one more, that's good. All right. I might just move on. So that seems to have stabilized. So this is Yuri's story. Again, now we've got some more non-traditional health services, I guess, where we've got virtual triage happening in the Health Direct. Got some ambulance and emergency department interactions there, hospital admission, discharge, and then the transition back to another state or the home state. And then we've got some local health service coordination with a telehealth appointment with a specialist. There's some provider directory interactions there to find one within the particular context of, within the region of making it easy for Yuri to get to, some transport arrangements. There was even some context around his need for or preference to be speaking to someone that was speaking his home tongue, and then aged care coordination. All right.
So sorry, he's just on that. If we weren't involved with Yuri's story before, but we can still see application of what we're thinking about this
absolutely.
time.
Yep, absolutely.
That's still relevant?
Yep.
Yeah, okay.
We're really just trying to work out which story or which parts of the story that we're going to throw in that you really want to actually get involved in. So we're not wedded to exactly what was done in the demonstrator. It's really just a guide, a bit of a framework. And we can go beyond it. We can extend on it. We can deviate from it. All right. So what are the common themes, connected care themes that you would like to implement? So story aside, again, some of those other orthogonal aspects, population health, notifications, AI, CDS. We've got things like the structured forms, appointments and booking in there, accessing the provider directory, e-referrals, e-prescribing and dispensing histories, and diagnostic reports and remote monitoring. So again, I've folded some of these up together just because I can only fit so many on a screen. And so I've tried to sort of correlate them to some extent with those stories, but also some logical groupings. So, if you just want to do e-requesting, that's fine without the reporting. If you just want to do remote monitoring, that's fine. Just put your dot on there as well.
You gamed it well, mate. There's no zeros.
So I think there might be one more. We've got one more minute, so I might move through, and it has stabilized. So if you just haven't pressed the button and you're about to, do it very quickly. Excellent. That'll do it. So last one, what other connected care scenarios would you like to implement at the track? And this is the last one, which I'll leave with on for a while. So you can call that, and I'll just go back to the slides to close out. So next steps, pretty much, we've got some logistics. We've got to, we're trying to gather, people that are explicitly interested in this, organizations that haven't signed up already. If you're on the call and you haven't actually put your preference for the track, if you can go to this HL7 Australia survey to indicate your interest in the track, and not just this track, there are the other tracks that are running, AU Core and e-requesting. You can sign up for more than one, but in particular, I'm interested in you being interested in this one. So I've invited some people that I just thought might help us fill the stories, so that have not necessarily been involved in the past and haven't signed up. So it would be great to get your specific interest in this. There's also a Connected Care Consumer Journey track channel, chat channel on Zulip. So if you don't know what Zulip is or the chat.fire.org, please email me and I can help you. But there is a QR code here for that particular track channel. This is where we will have some coordination going on offline. Going through, we'll use it within the Connectathon itself. And then there's this track page where I will ask you to start to fill out participant and system details in the future. Again, don't have to do it yet. We've got 6 weeks to get there. But this is where people will refer to your system, how to connect to your system, what your authorization details are. But as we sort of work through which areas of interest you have, it will be great to have that documented in the wiki. So this track page looks like this at the moment, gives a little bit of an overview around things. It's a standard thing that we do. For it, there are some sub-pages where I'm going to put the recording and the slides to these coordination calls, and each of those will get added as we go through the next 6 weeks. There is another page here for the track participants. Here you can see the type of system, whether you're a hospital system, what theme you want to work on, whether there's a particular story you want to work on, what station you want to work on, and then we'll start to get your technical details over there, and you put your contact details and organisation and system details on the left. I've also set up these couple of pages that's just giving you a quick reference to what I had in the slides there. We'll probably add some extra content there in due course, and another one for Yuri. So thank you very much for attending. As I said, if there's any questions, please don't hesitate to contact me or Jai. And the plan, I will send out another invite for a meeting next week, same time, same place. And we will start to get a bit more feedback and hopefully start to see some clustering around some of those stations, or at least the theme, so that we can start to group you together and see what you guys can come up with.
Thank you, Hughes.
Any final questions I'm willing to take, but pretty much we're at time, so I'll hang here for a little bit if you want to hang back.
Thanks, Heath. Jai. Thank you.
Hey, Heath.
Angus, you're very quiet, mate.
It feels like you just want magic.